the second week of March. I took me and our software team to do a full last run through for our demo. This is what we've been working on, and we had an issue where a lot of clinicians and a lot of different clinics don't have a background in neurology, so we had to try to make this an automated system. So a lot of people don't understand that you can do different sensory inputs. So what we did, for those of you who do have clinics in multiple locations and it's hard to train functional neurology, on the screen I had made it to where it's going to give you the option to have an automated system where we develop different levels for each the left and the right side of the brain based off of certain conditions. But then it also talks about what sensory inputs. So using smell, using eye lights, using glasses, and again, our sound is lateralized, and then we are launching our VR component, which I'm going to show you guys some of the games that we've developed. So one thing about working with autistic kids, especially, and I see this a lot of times too with female population doctors, being a little too sensitive to get on the ground with kids. So like right now, my glasses are broke from this week from being kicked in the face. And it's just something, when you're working with these kids, you have to physically get down and assess these kids. And if you're too passive, you're going to miss a lot of things. And so in my examination, I'll let parents know, first of all, look, I'm not going to harm your kid in any way, but I might have to physically get on the ground with this kid. I mean, you might literally sometimes have to wrestle these kids. Dr. Schuyler and I were talking about different cases last night with working with certain kids, and you never know. I mean, like, I've had a kid literally first day run in my office, take some scissors from his mom's car, jab his eardrum, and he's bleeding out in my office. And again, it's just these kids, you never know what to expect. Every kid's going to be completely different. I had another case. I had an assistant of mine, this autistic kid, he was about 15 years old. He's laying down, and he tells my female, one of my patients or assistants, to come see. And this guy was kind of hypersexual, and so she leans in front, and this kid just goes up and just grabs her, and it's just, again, you never know what to expect. So, but yeah, you do have to get on the ground sometimes with these kids. So today I'm going to talk a little bit about the progressions of how we use NeuroSage, but I'm also going to talk about the acupressure points that we use, and these things are super, 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 super important. So whether you have a NeuroSage or if you have the laser, I highly, highly recommend to learn these points. And so what I did is I have the meridians, and then I have the actual capture pictures of the beginning and the ending point. And that's what we're going to talk about, how to stimulate that. Also too, Instagram, and I'll mention this every single time. Instagram is something that you guys definitely, if you have a practice, you need to get involved in that. You need to, again, if you have kids that come in with primitive reflexes, and for our office, we have patients sign video, release of waivers so we can use stuff for public access. Again, I don't really get their face, but I do a lot of primitive reflex pictures, videos. This is a great way to generate income. So people fly from all over the world, India, Australia, Europe. On a monthly basis, someone flies from the UK to my office, and they discover me off social media. And it's really neat, because in order for us to be able to create a movement, if we all start getting involved and we can start tagging, Dr. Melillo and Crawford and I do this all the time, we kind of link each other up, but people need this information. No one knows this stuff. Rob's in the Middle East doing stuff. He's in Bulgaria. These kids all across the world have the same problem. It's just, different backgrounds. So again, social media, we'll take a picture after this. We'll post it up. My Instagram up here, go to it. You'll see that we have 30,000+ people that will start looking at all this stuff, asking for, what doctors and what locations. So if you have it, end of this weekend, follow, go click it, type in where you're at, and we'll start generating some patients. All right, so there's different ways to stimulate the brain. And what I think sometimes happens when you take a class like this, sometimes you might feel like it was a little overwhelming, and it's kind of like, all right, well, how do I put all this together? And so my presentation is going to just be how to take a lot of this sensory input and how to, apply it using NeuroSage and laser. So again, there's different ways to stimulate the brain. You can use laser, you can use essential oils, you can use music, you can do finger to nose exercises. There's a thing out there called the brain tap, which is pretty cool. Uses sensory stimulation and acoustics. There's physical rehabilitation, there's chiropractic, there's acupressure, acupuncture, and then there's massage. And at the top, there's vibration therapy. So your brain is a sensory sponge. So using specific sensory stimulation could be very, very beneficial. And then you can start layering these things on. For example, using smell, using sound, using vibration, using laser, using TENS. And again, sometimes it might take that much to be able to help get rid of a primitive reflex. Especially you'll see people that'll come into your office, they've done the Muscatova technique for 10, 15 years, and they still have primitive reflex. Well, if you start using maybe some sensory input like using sound or using light while you do the primitive reflex, now the reflex actually starts to integrate. And it's just that the more that you understand using targeted sensory stimulation, you can start getting rid of that reflex a lot quicker. So my favorite way in is I love sound. And, I did a lot of research over the deep brain stimulator, and, it's public knowledge. You can go in there and look. It first started out where there's research over, it's called the external auricular stimulation. And what they were doing is they had this little input where they were stimulating the auricular branch of the vagus nerve. And so they found that using 130 hertz would actually stop Parkinson's tremors. And it's public, it's out there, you can look at it. So what you can do? You can take a tuning fork, and you can try 130 hertz and see what happens with someone's tremor. You can take 10 hertz and again, try that if you're trying to work on getting rid of primitive reflex. Maybe use 10 hertz, maybe one the left side of the ear or right side of the ear and see what kind of change that makes. What I did with NeuroSage is I took in all the factors of different frequencies for the cerebellum, looking at stuff stimulate the brainstem, looking at different alpha, theta, gamma, delta brain waves, and we just bedded this stuff in. And the way I made it is every 5 minutes when you do a program, whether it's a game or one of our video files, these frequencies cycle through. So a little bit of a concept here, just left brain, right brain, sensory stimulation. All right, Rob was talking about this. All right, so this slide, I think I mentioned this last time, but I just found this slide, really amazing, and Rob mentioned a little bit about this earlier, but this is actually a picture of the research that shows, you take these two mice in a cage, they don't do anything besides just eat and kind of walk around and drink, and then you put these rice into an enriched cage, and then now you start seeing multiple nerve cells. And think about these kids, they do the same repetitive stuff. They wake up at the same time, they eat the same thing, they watch the same shows over and over and over again. They don't change anything. And so when you start making change, you start stimulating the right side of the brain. I had one mom tell me, she said, hey, my kid, we literally have to drive the same exact way to school. And if I make any wrong turn, or if I have to go, to the grocery store, he freaks out because his left brain is so over dominant. And so it is, we have to start changing things up. And so the more that you start changing, again, you start building different networks. So Dr. Crawford and I, this is us right here. This is one of our tunnel. This tunnel is found in our therapy section, super powerful right brain stimulus. We use this a lot with patients with behavior. You get a really severe autistic kid that comes in. This is your kid that, he's running before he even gets in. And this is what we use to calm him down. And I'll show a video. And I did this in the Chicago module. I think the first module showed a video, but this is one of my really severe cases in Dubai, how we took this little kid in literally one visit, got this kid to, calm down and start making eye contact. So what is multimodal sensory stimulation? So this is us stimulating the right side of the brain. Laser in the right frontal lobe, we're doing the midbrain, using sound. I'm using vibration on the left side of the body. She's standing on a vibe plate at 10 hertz, and we're doing, visual stimulation with vestibular. We're having her rotate her head left and right and tilt with the screen. All right, so stimulating the right side of the brain here. We start off with using our therapy section, our right brain tunnel. And so I put on top of here that we place the patient in front of NeuroSage, and then we see if they can actually just stand for 5 minutes. And that's kind of the goal. So if they can stand consecutively 3 times, 5 minutes without breaking down, then we progress to the next level. And the next level is going to be the same exact thing, but now we're going for 8 minutes. And the whole goal, and we do this stuff to start kids out. First of all, when you take a kid who's severe, and these kids don't typically want to do exercise, the one thing that's kind of very familiar with them is video games. our television screens. So we actually try to get them in front of this and start watching this. And it's, again, it can be kind of monotonous, but what happens to these kids when they start doing it, they get engaged in this right brain sensor stimulation, these kids start leaning into the screen. And I mean, they'll literally stop from, if you could be 4 feet away, and then the kid's trying to get as close as he can to the monitor and put his head and face on it. So again, 5 minutes, 8 minutes, and then we go for 10 minutes. We do that 3 consecutive times. Then we progress into our games. So I put on here that some kids respond by better standing at 40 hertz. Okay, so first we use a vibe plate. We start at 10 hertz, then we progress to 40. Now, why did I put this in here is because some kids you have to adapt. And Dr. Crawford and I have done this a lot where we've taken kids who are runners and they're not going to sit still. We physically actually take these kids and we're standing up on a vibe plate with these kids at 40 hertz. Okay, sometimes we're actually kind of bouncing them up and down because these kids don't jump on a trampoline. So they need sensory input, in their spine. So this is what we'll do. And I have a video here. Let me play. So you can see this little kid.
Can I see your hands? Watch this. Oh, you don't like the bend? No. What's that?
Where's that become? I was inside, no fun.
Elephant? Where's an elephant? Look, here. You got it. This is the thing.
Stand up. Okay, put your give him five. Give him five. Give him five.
Alright. Thanks, buddy. This one?
Yeah.
Good boy. Good job, buddy.
So Dr. Crawford has this kid bouncing up and down on a vibe plate at 40 hertz. So this right here, we have specific frequencies going in embedded into just some right brain music. So we do have proprietary frequencies inside of this stuff, but again, it starts out first. I kind of start with the cerebellum. We start at 10 hertz, and then we start working our way up. So then it goes from a blue screen to a green screen. And so you see these kid, how he starts out first, and then we went from taking this kid, first of all, he went from Dr. Crawford bouncing him, to now we place this kid sitting, he's standing there by himself. Start seeing him lean in, and a little bit he's going to start stimming, but he was stimming after about 2.5 minutes. But these kids will do this. They will literally start staring at this screen, and their head will start, they'll just start, getting involved. Like their nose will literally touch the screen. So you can just imagine taking a, like a fear paralysis tomorrow, and then now this kid's just calming down. Now what we did, so Dr. Crawford and I, we were in this hospital, and we did this research trial to see, if sensory stimulation can help out with, making any type of behavior improvements in some kids. And so this was part of our research project that we did in Dubai. Okay, so not everyone, so we built a package deal with NeuroSage where we just have the software application itself, and then we have additional components, which is like the vibe plate. So, yeah, so there he goes. Now he starts stimming.
Is that like too much stimulation?
Yesterday,
he was laughing and he was looking to our eyes with a like smart smile, let me say. Even he repeated many words like what you want to do or what you want to do now. I want to sleep. I repeated to him, but he repeated quickly and he never said I want to sleep. This is the first time. So even today in the morning he wake up 7, he usually wake up 5 o'clock, so he sleeps 2 hours more. This is like great improvement. Waking at 5 o'clock was really bad.
So this was pretty cool. This got this kid to start making eye contact, starts having an emotional component, laughing, and then he's also sleeping an extra 2 hours. And we had another other kid, the same thing. So we got these kids literally to start, increasing their speech. And again, people ask, well, speech is more left brain. It was like, yeah, but you'll see a lot of nonverbal autistic kids, they have a right brain delay. They still have some left brain issues, but just stimulating the right side of the brain. And we did 5-8 minutes of sensory stimulation with this kid, and this was the next day. So that's pretty quick results. And so when I met Rob, originally it's kind of neat how we met, but I told him, I was like, hey, look, man, I'm working with all these kids and we're getting rid of primitive reflexes really quick, and we're getting great improvements where, we're getting some of these kids to start speaking literally in just, a week. And that's pretty powerful stuff. And again, it's about, does this stuff work? It's yes. So the more that you guys are taking this course and you're understanding that, hey, you might need different sensory stimulations, and that's what we did with NeuroSage, is just using multiple sensory stimulations to try to start optimizing outcomes at a faster rate. So then we go to level 4, which is now we switch from the tunnel to we go to rollerball. And then I have here, which I've mentioned a couple times, but we have them just standing, both feet on the platform at 10 hertz, and then we progress in to try to get them into tandem, right front to left. And again, the goal here, and so I wrote this way, is because some people have insurance practices. Most of you guys are cash, but sometimes, people are only given a certain amount of visits, which when you're working with these kids, you can't really compartmentalize these kids in a certain amount of visits. They need, more than likely lifetime care. But I wrote this out for some of you guys who that happens, where you have to kind of progress. But really, if a kid can't stand in tandem with their right foot in front of left 3 consecutive times, then you don't progress to the next level. And then the next step here in level 6 is where we have them standing with their left foot on the vibe plate, right foot on the Bosu ball, 3 consecutive times. And then you progress from same thing to 40 hertz. So level 7 here is they're standing with their left foot on the vibe plate, right foot on the Bosu ball TheraBand at 40 hertz. So we start with 10 hertz, stimulating cerebellum, and then we go to 40 hertz. Then I have here level 8, where we have them stand and we have them balance on their left foot, okay? So I have a pretty big staff, and I'll have them where I have a patient, they're standing on the vibe plate at 10 hertz, here at level 8, and we're supporting either their hip or holding their right leg up. And you'll see that it's going to be hard for them to do that, but we're just trying to really constantly, do a lot of sensory stimulation to the right side of the brain. And so on the right side of the screen here, I put additional sensory stimulation. So, NeuroSage is the software application, but then the more you understand this stuff, you can apply more. So then I put 10s. So on the top part, I did acupressure points, stomach 36 and spleen 6. So, and then you can see this right here. So stomach 36 is, if you go about 3 fingers below, it's kind of right on the fib head, all right? And then spleen 6, it's going to be 3 fingers above the medial malleolus. And so I like to use, when I do TENS pads, I like to place my TENS pads on the left leg, okay, to drive the right brain. Then we'll progress to putting pads on the left side of the spine. And then we'll use different type of sensory stimulation. So we might use peppermint or eucalyptus. And then we'll use blue lenses. My vibe plate setting at 10 hertz. And then the very bottom, I put the acupressure points, which I'm going to go over. So we stimulate all beginning and ending acupressure points when we start. So we get the kid, we put the headphones on. Sometimes you're not going to be able to get the headphones on, but if you can, we start stimulating the beginning and ending acupressure points. And I do it with just fingers, or you can use a laser pointer, okay? Then we have here, progress into level 9, where we have them doing Brick Breaker, which is another game that we have, and we go through the same progression. So feet together, 10 hertz, level 10, standing tandem, right foot in front of the left. Yes, ma'am.
Are these 15 minutes?
They're 15 minutes.
Ideally.
Ideally. And then we have a level 11, where they're standing with their left foot on the vibe plate, right foot on the BOSU ball, so you can see there's a consecutive pattern here, okay? And then we have level 12, where we have them with their left foot on the vibe plate, right foot on the BOSU ball. Now we're cranking up to 40 hertz. So 10 hertz, 40 hertz, then we go ahead and stay on the left leg. Do you have a question, Peter?
Brick Breaker, you're not seeing a low functioning autism, you understand the concept.
No. And so that was kind of my levels. Most of those low functioning kids won't ever even get past rollerball. So, I mean, because those kids can't even, even stand in tandem.
But they do like watching also play.
Correct, and that's where the next slide I do have that right there. It says if therapist in level 9 says therapist, doctor, parent may play the game if unable to, and I put that here for rollerball too, because sometimes the kids can't even focus. And again, it's kind of these kids still have primitive reflexes and they can't even volitionally control their gaze fixation. All right.
What's the frequency for the hertz?
I just go up to perception. So most of the time it's going to be like 2 to 4 bars.
Okay.
So you use a BOSU ball for the balance?
So a BOSU ball is a half moon ball. Yep, and I just have them stand on I just have it to where they're standing on the actual soft part. So their right foot will be on the BOSU ball, their left foot's going to be on the vibe plate. You can use a TheraBand balance. I just use in my office. That's what we use. It's just a BOSU ball, but you could use anything else. I mean, you can use a TheraBand balance pad.
Stable versus unstable.
So I don't know if you know of George Kirkland, but I started using. There's a guy. He does chiropractic neurology in Phoenix. When I was earlier on in chiro school, he was using, when I was studying vibration therapy, he was using that. And he just, made some of his teaching was that the standing with their, opposite side off the vibration was dampening the cerebellar input from the right side. So that's just why.
I agree it would.
Yeah, so that's why I've been using BOSU balls. So, but yeah, I mean, like we have stuff in the nursing home where they don't, they're not going to put a patient with balance issues on a BOSU ball. They'll put them on a TheraBand balance pad. In our clinic, I like using that. And then if you work with professional athletes too, I have them do our video games, and I'll flip the BOSU ball upside down, and I have them playing our video games in a half squat position on 40 hertz. And it's pretty interesting because you could take an Olympic athlete and show them that they don't have good vestibular systems. All right, and then, so this is the new version here, but we do have this new game here coming out in our virtual reality system. It's going to be a forest, and it's real live looking, and you'll see here in a second, but that's our last level that we're putting these kids in. And it's really neat because it's like, I had parents tell me that, hey, there's no way my kid is going to put on a headset. And when you put these kids into a virtual reality world, they can go to town. So I've taken stuff where originally when I was started developing, I was using Oculus Rift, and I was having these kids go into a paint section, and I was having these kids put VR on and start painting objects. And some of the paintings that these kids did were, just impressive. You can take, you can make 3D worlds, and it's just amazing what these kids were doing. So, these kids will put on a VR headset. And I've even seen some very, very severe kids placing headsets on. So, and again, using additional sensory stimulation while they're on that. So we'll still use tactile, we'll still use TENS units. We'll still put sensory, good. We'll still use essential oil, we'll still use vibration. And again, I do stimulate these beginning and ending acupressure points. So, vibe plate settings, I wrote them up on here. So again, we started at 10 hertz, and then we progress into 40 hertz. All right. So beginning and ending point. So if you have the shed light laser, and if you go on there, you'll see this one says, it says Dr. Daigle all. If you ever do hit up beginning and ending acupressure points, put this on the umbilicus while you do that. Why? That's what I've found, clinically, that's what I've been doing for a long time, but there's a lot of applications showing about how energy, stimulating the umbilicus can help out. So that's the placement that we use. The shed light laser. So they have the little laser stand. So what we'll do is we'll just place that and place it right over the center of the umbilicus. My staff or me will go through and hit up all the beginning and ending points, which we knock them out in like 2 minutes. The laser directly on Dr. Daigle all while you're going to hit these points here. So to research this stuff, if you look at, so the beginning point, they're always going to be starting out with number 1. So whether I'm doing the lung, the large intestine, triple heater, gallbladder, and then the ending point is always going to be the last number on the meridian line. So the pericardium meridian, so it starts out, and again, PC1 is here, and then the PC9 is here. So what I did for you guys is I placed, not only do I have the meridian, but I also showed you exactly kind of the anatomical location at a closer, so just kind of a little bit lateral to the nipple, and then we go to the pericardium 9. So this is the beginning point, this is the ending point. So we stimulate these things at the same exact time. So we'll touch this point, pericardium 1, pericardium 9, the same time. So just stimulating. All right, then we go to the lung meridian. So the lung meridian 1, lung meridian 11. So I have the point right here, attached on top of here. And I wrote it out here. So stimulate the beginning point and ending point with using a laser or manual pressure. So the shed light laser does also have a laser setting that says beginning and ending points too. So if you have multiple lasers, you can also use that one to stimulate the acupressure point, or you can just use your fingertips. Okay, now it's going to take you a couple times to get used to doing this, but it does work really, really well with calming these kids down. And then it also helps out significantly with improving their arm swings. So when you'll see an autistic kid, when they're walking, or even a kid with ADHD, watch their arm swing, and then you stimulate these beginning and ending points, and then you're going to start seeing that their arms are going to start swinging more when they walk. Okay, now if you guys want to learn more about this, then in the AK book in chapter 7, they have a lot more about different muscles that are associated with these acupuncture meridians. So again, theory could be that when you're stimulating these beginning ending points, you're helping activate these muscles that are associated with these meridians. Is that true? I don't know, but I do know that from a clinical standpoint that when you stimulate these points, these meridians, we've seen a lot of arm swing improvements. Again, so the large intestine, so we'll stimulate the large intestine 1 and then the large intestine 20. So here and here. Now, this point right here, I mentioned last time, but kids with pandas or involuntary movements, that this point right here, whether you stimulate it manually or use a laser, can also help out with suppressing involuntary movements. So when you get a kid that comes in with pandas, or you have a kid with Tourette's, or you get a kid who is diagnosed with ADHD and they put him on amphetamines, and 2 months later he's starting to have strange involuntary tics, vocal tics, we use this point. Okay, tapping it, you can stimulate it for a couple seconds. Depending on the severity of their involuntary movements, you could go to even a couple of minutes of stimulating that point. All right, so the small intestine will stimulate here. So I have it right here. So small intestine 19, and then small intestine 1 on the lateral aspect of the pinky now. Okay, now this is really interesting, is that I've found that a lot of these kids who have digestive issues and they have chronic constipation issues, when you start stimulating these points, they start having, they start going to the bathroom more regular too. And again, there's people out there who do acupuncture and they just stimulate these points. All right, so then we have heart 1 and then we have heart 9. So heart 1 here in the armpit, Heart 9 in the medial aspect of the pinky. All right, and then we have the triple energizer or triple warmer. So it's going to be the lateral aspect of the eyebrow. And then we have the triple energizer or triple warmer 1 on the lateral aspect of the ring finger. Now this point right here is really interesting. So if you work with patients with neuropathy, little clinical pearl here, that this point right here, if you stimulate this point, it will help out with sensation. So I use a vibe plate in my office. If they have pain, we'll start out at 31 hertz, stimulate this point with a laser or just manually touch it. If they have, numbness and tingling, we'll also stimulate this point and we'll crank the vibe plate up to 40 hertz. That's just an extra little clinical pearl there, and it works really well with reestablishing better sensation to their legs.
So you're doing the tapping and the vibrating at the same time?
Yep, multimodal sensory stimulation.
Is it bilateral?
When you see most neuropathy patients, most of the time, yeah, if we'll stimulate both sides. I also I work with a lot of traumatic brain injury patients. I also use this thing to help out with patients who have paralysis. So if I want to get someone's foot to start to move, or toe or hand, we'll use this point. Same thing if someone has weakness in their quad following a stroke, or their hand will vibrate the area, and then we'll stimulate that point, and then we start getting better contraction and better control of the extremity. So the what? Yep, ipsilateral. So again, all these things are in here, and again, it's going to take repetitive times to look at it. If you start doing this in your practice, maybe pick just the upper extremity one day and start stimulating that, and then maybe the next day do lower, and there's alternate. In about a week, 7-10 days, you'll have these things down pat. But again, when you start seeing outcomes, then you're going to start, you'll start using this stuff a lot more. Bladder. So bladder 67, bladder 1. I was in Amsterdam, and we had a kid with a spinal gallant, and we just stimulate just these points right here, and the spinal gallant went away. And again, so doing inchworm and doing snow angels, all those things work. And then also if you start adding in and you start understanding, so the bladder meridian, look where it runs all along the spine. I find a lot of patients with, and again, from a chiropractic standpoint, have patients with low back pain. We stimulate the bladder acupuncture meridian by the beginning and ending point, and their back pain starts to, reduce. It's great for spinal gallants. So again, bladder 1, medial canthus of the eye, bladder 67, lateral aspect of the pinky nail. And so when you look at the laser and you see the shed light say it and it says Dr. Daigle, what those programs are, those are all frequencies for acupuncture meridians. So if you're physically stimulating these and then you have that laser, it's an extra external way to help out with, stimulating these meridian points. So that's what that is. Gallbladder. So we have here on the lateral aspect of the eye, and then the lateral aspect of the fourth toe. What does this get rid of? If you work with a lot of athletes with ACL issues, this thing actually helps out with getting rid of knee pain. And I do a lot of ACL and PCL rehab in our clinic, and these are points that we use. Then you have the kidney meridian. So we have the kidney 1, kind of in the center part of the foot here, bottom of the foot, and then K27. I know, and again, I don't practice AK, but this is a pretty common little spot that they rub with neurological disorganization or association. Yep. Okay, so this thing right here gets rid of hip pain. Stimulating both this. And then we have the liver meridian. So we have liver 14, we have liver 1. So I'll put here liver 1 on the the medial aspect of or lateral aspect of the toe, and then liver 14. So again, stimulate beginning and ending points, same time. And we have spleen. So we have spleen 21, spleen 1. Stomach meridian, which I already went over that one. So stomach meridian inferior to pupil, and then stomach 45. All right, so I like to use blue color lenses. Dr. Gillette said, a couple of modules ago about the eye lights. I like using the eye lights as well. And again, we use different sensory inputs when we have, we're doing neurosage. And again, I put the eye lights just so that way the spots, from the visual field, which ones stimulate the right hemisphere. We'll throw on some sensory stimulation, some oils on the right collar of the shirt. Vibration therapy. Sharik did a great job. I love the ResiMax. We use the ResiMax to help out with all of our sensory stimulation on top of vibration to ViPlate. There's TENS stimulating, the left side of the spine, or the left stomach 36, left spleen 6. Now this is the difference. Why start on the leg, then go versus on the back when you start having severe, kids? A lot of them, if it's easier for them to see what you're doing. So if they start putting pads on their back, they get really irritated. So we kind of work our way up. So starting on the leg, and instead of just randomly placing it on the leg, we place on those specific points. And this whole stuff is all about precise sensory stimulation. So the more that you can learn these acupressure points, the beginning and ending, and you stimulate those exact points, and then you start, again, using sensory input. These are all what it takes to be able to take a kid who might take a year and a half or 10 years to get rid of a primitive reflex. Now you're starting to integrate these reflexes a lot quicker. So I put on here just additional stuff because I know some of you guys are going to be in practice this week. What can you do? So the next thing that I have on here is my favorite thing that I use it's called Motion Guidance Program. So it's about $200, but we have a whole station in our office where we have these kids go through, and what they'll do is they stand in front of us or sit and put a headlight laser on them, and then we'll start doing head movements where we'll have them go vertical, up and down, left and right. And so Dr. Miller talked to you guys about doing saccades and pursuits. So what we can do here is we can have these kids go passively or actively, or they do a pursuit to the right and a saccade to the left, pursuit to the right, saccade to the left, stimulate the right brain. Or what we might have them do is do fixation. So we might fixate down here 5 seconds, 5 seconds, 5 seconds, 5 seconds, 5 seconds, 5 seconds, 5 seconds. And then saccade back. So again, the more that you understand how the eyes work, you can start taking different applications like this, and you can progress from standing with feet together, then you start putting in tandem, right foot in front of their left, then you can progress to having them stand on a Bosu ball, and then you can start tacking on different sensory inputs while you do this. All right, show you some of the new stuff. So what's new coming out here? For some of you guys who practice and see a lot of pain patients, there's a lot of research out there, and they did this in the military with people with skin grafts, where they would take these guys and put them into a virtual world, an ice world, and they were able to perform skin grafts without using anesthesia. And so we've also developed a couple games, but one of them is this game here called Snowball Mayhem, where you throw snowballs at this guy, and it's pretty interesting because it does work, especially patients like RSD, or you even work with patients with phantom limb pain, that we're using this sensory input, using ice worlds to try to help out with alleviating pain. Okay, so we did make this game, and again, this is kind of a shooter game, but it's not, you're not shooting guns, but you're shooting laser beams. And I made this one, wanted to make this thing to start trying to work on improving the immune system. So there's lots of stuff out there about interoception. A long time ago, I read a book from Dr. Patrick Quillen over cancer and how this guy was working with patients from a psychological standpoint, trying to teach them to start, visualizing their immune system start working. And the brain controls the immune system. So we made a little left brain game here where you go through the body and you actually go and shoot off bacteria, viruses, and parasites. And again, so your left brain kids, which again, we're talking about right brain here, but your left brain kids that are chronically sick, this is just a little form of entertainment where they can start, using sensory input to start, improving their immune system. We also made another game right here called, it's a Simon Says. And then here's our right brain VR game. So the right side of the brain, dealing with forest and nature. You walk through, picking up clues. It's pretty neat. It's also, you physically have to like move. And then we have a left brain beat saver, for your left brainers. So that is the rest of my presentation. And then I did add some stuff on here. I put extra where I wrote some pain protocols for some of you guys who do work with pain. And then I wrote down different frequencies for pain if you do want to use a tuning fork. These things work. I put exactly, shoulder, hip, knee, and then, different things that you can use a tunnel. We do a lot of finger to nose. All right, that's it.
One of the things I will say is that like I told you, I had a bunch of people recently that had done a lot of primitive reflex work. And one of the techniques out there's a woman who wrote a book about it, and she only uses the acupuncture points and laser stimulation to try to get rid of primitive reflexes. And I can tell you that I've seen a number of people that have done that, and their primitive reflexes are still there. So just using the acupuncture points, but she does correlate certain acupuncture points with primitive reflexes and certain hertz frequencies. So it's a good tool, but just using that alone, in my experience and what I'm seeing with my patients, is not going to get rid of the primitive reflexes, okay?
Right. Okay, are we ready? Are we good? Okay, so bear with me. Today's the best my voice has been yet. I was working with a patient on Thursday. I started at noon, and by 1 o'clock, I literally had no voice. Like, I got hammered with some laryngitis, and I could barely speak. So, I've been using the laser, I've been using the Resimax, and I got an herbal spray on Friday before I came, and now I'm doing a lot better. But, so bear with me. We'll do what we can. But yeah, Sherrick was actually the first person I texted. I was like, hey, where do I need to put this thing? I'm losing my voice. And so that was pretty cool to be able to even just rehab some vocal cords, So, all right, autism module. We're nearing the end of this module. I hope that you all have learned a whole lot, One thing that I would personally like to bring up is that, Dr. Melillo started talking about all the various people that have been involved with autism, and the initial doctors that kind of found all this information out. But obviously he's not going to say it, but I will. Is that he is the leading expert. No one has come along and taken all of their information, which was just kind of sitting there, and no one knew what to do with it, right? Because it was not functional. It was all about a diagnosis. There wasn't a whole lot of treatment strategies. There wasn't really anything that anyone could really get hopeful for, right? And then Dr. Melillo came along, and I'm telling you, whenever Kyle and I had the opportunity to be in Dr. Melillo's home in New York with him, and being able to listen to his heart and watch him cry about being able to get one of these autistic children to love, which is really the ultimate goal, right? And we're going to talk about love a little bit in my lecture. And seeing the tears stream down his face it's huge, and that's what this is all about. It's about changing lives. So in that regards, there literally is no one else. We are in the presence of a hero. He's legendary, right? So I'm very grateful for that, and just wanted to point that out. So, okay. So with autism, I think Peter did a great job of talking about expectations, okay? And that is one thing that I've learned on that first visit, is to sit down with that parent. And one of the questions that I always ask is, what are your goals? In fact, I have it listed in my paperwork. What are your goals? Because you will see some parents that will tell you, number one, I want my child to speak. That's their number one. Okay, you want your child to speak. What's their gait like? How's their vestibular sense? All these things. of course, as a parent, they're not really sitting there going, well, I'd rather my child be able to walk a straight line. No, they want their kid to speak. They want their kid to have a conversation. They want their kid to be social. They want them to interact with the world. And they need to know, okay, you're going to be, in my model at this point in time, that they're coming in for an intensive. So they're in for 1 to 2 weeks, right? So by the end of the week, this is what my goals are, right? So being able to communicate that. And here's why I developed that, because back, about 9 years ago, when I really started working with autistic kids and started doing, a lot of this work, my first, what I would refer to now as an intensive, was a severe autistic kid, and I was with him for a week, and I was doing all of Malolo's work, and that's what I did. And at the end of the week, I didn't see any major changes. Now, I was not as good of a clinician then as I am now, and I probably, I sure as hell could not do an exam like I could do now, and I did not have this exam to go off of now, but it was Friday morning, and I remember I was so, scared, just to be honest, because I had to go and talk to this parent who paid, I don't remember what they paid. It was probably, a few grand, whatever I was charging back then, to be with me for that week. I'm like, crap, this kid didn't get any results. What am I going to do, right? And so we go into this, exit exam, and I'm talking to the parent, and I literally start the conversation with, look, I'm sorry for this week, and I start going down this road, right? And the parent stopped me, and she goes, what are you talking about? She said, my child hugged me for the first time ever last night. That is worth every penny that we paid you. The child was 13 years old. So that minor change, to me, was a life-changing alteration, a huge thing to that parent, right? That changed the trajectory of their life, okay? So that, in my mind, really set, my goals and whatnot about, okay, that child now learned how to love. That child learned how to express affection. That was huge, right? So that's the type of thing that we need to be, looking for and expecting. And sometimes, like when I was in Jordan one time, and I was working with all these kids, and in 3 days, I took a nonverbal autistic kid, and they started speaking in 3 days. And literally, the first words that this kid said was, American doctor. No joke. American doctor. And, I woke up to a text, of this kid saying American doctor, and I'm like, holy crap, So that can happen, right? I don't ever want to limit what can happen, okay? So it's pretty cool. All right, so let's move on here. All this stuff. So one thing that I want to do right now is I want to show you 4 different cases. These are all right brain deficits, okay? They all presented differently. So at what point is this autistic, right? Like this kiddo, he actually has the 3rd highest speedrunner score in the nation, I believe. I've got the 2nd. Last I checked. 17,800. No, actually, I think I got up to 18,000. You got, when did that happen? When did that happen? Oh, okay, I haven't seen it. Dang, okay, so I guess I'm down to like 4th or 5th. I'll beat you this week. All right, anyway, so just listen to his story real quick, which I guess I could do it from here.
Hey guys, so Dr. Crawford here. We've got Matthew here, and I'm holding him aside just because we've gotten such good results with him. And I'd like to really take this time to explain how functional neurology affects the brain, but also how when you address the imbalances within the brain, you can actually affect the body as well. So Matthew came in a few months ago. He had some pretty intense pain in his abdomen. He had some nausea to go along with that. So I'm just going to let him tell a little bit about his experience and how he's doing now. So Matthew, if you don't mind, man.
Yeah, when the pain first started, it was just all around the middle of the stomach. It was horrible. It would happen in the mornings, I wouldn't want to get out of bed. I would just be laying around, writhing in pain. I think got to the point where I thought the pain was never going to go away. I saw countless doctors, went to the hospital, did plenty of tests. It all came back negative and nothing was showing up. But then as soon as I came here, just with the first visit, my nausea was getting better and my pain was not happening as often. And with just a couple annual weekly visits, I eventually started to not have any more nausea and my pain completely went away.
Yeah, so he told me today that he's 100% better, which is phenomenal. We've been hovering around that 80, 90, 95% range, and so now we're 100% better. So Matthew actually had to drop out of school or stop going to school. He's been doing homeschool because of this issue. So obviously that's going to be a change and things you're going to move along in life. But so basically, with Matthew, he had this imbalance in his brain. And whenever your brain is imbalanced like that, your fight or flight system or your sympathetics become ramped up. And whenever you're in your fight or flight mood, blood is shunted away from your abdomen, from your organs, because you have to run away from that stressor. Okay, so then you start developing pain, or maybe your gut starts to break down, maybe you develop a leaky gut, and that's going to cause inflammation and other things. So you can do whatever you want to that organ or that system or whatever, but if you don't address that underlying cause, the imbalance in the brain, you don't get results. So what we did was just a form of neurosensory integration. We used the neurostage. And then we had some laser therapy on top of that to stabilize neurons, to activate those organs, to do different things like that. And we did a few other little therapies here and there, but that was the main thing that we did. And we reestablished balance within the brain, and now everything's good. So just a fantastic story, and thank you very much. And let's just keep on saving the world, guys.
So Matthew, he had been, like you said, he had been to countless doctors. He had tried detoxes, he had tried diet changes, supplementation, medication, all this kind of stuff. And then the doctor literally told him, well, I guess we need to remove your gallbladder. Let's just take it out. You don't need it. It's, And, fortunately the family was like, no, that I don't, you can't even tell us why. But, that's why I wanted to do that video, and I think I posted it a long time ago, but I mean, that's how this can present, right? That right brain deficit, you heard me talking about the stress response, right? If your body thinks it's running away from a bear, are you going to be able to digest your food? No, your body's worried about running away from that bear. If you're running away from that bear, are you going to be able to reproduce and have babies? No, you're going to be worried about that bear, right? So that stress response can fuel a lot of different metabolic issues, a lot of different types of organ dysfunctions, so on and so forth, right? And that's what that was. But now let's look at this. So this is actually a severe autistic kid. He was in my office this past week. This is Gunnar. I'm going to go back and see him this week as well. So I just want you to watch his gait, okay? This is his gait.
Can I come back?
Just walk normal better.
This time run. Turn around and run, fast you can. Run. Turn around, come back.
All right, so what do you see in his gait?
He's really wide.
He's got a wide, unsteady gait. Yes, so pelvic core instability. What are his arms doing? Nothing. There's no arm swing, right?
How old is he?
6, I think, 5 or 6.
He looks like a toddler, the way he's walking up there.
Right.
Brinkating toddler.
Okay. So, this is going to be the next day. All right. This is just one day, and so I spent about 2 hours. I don't know, 2 or 3 hours with him. This is the next day.
Don't listen to your mom, just walk.
Exactly. Now hold on. I'll make him walk normal. Hold on. Tell his mom to shut up. Hold on.
Hey, come here. Look at me. Just walk to the plank and come back. Okay, go.
You see how I'm talking to him? Don't baby talk easy. Look, Gunnar, hey, walk to the plank and come back. Okay, shut up, Mom. Walk to the front. Okay, so you see how the gait is starting to narrow.
Okay, now look. Run. Go run. Run to the plant back. Come back. Come back. You gotta come back. Hurry.
Okay,
Great job. bud.
now, that's cool, right? So we're starting to see changes in the gait. Now, let's time out for a second. What I wanted to mention in that first video, here's how I want you to start thinking. What's the health of his rhombencephalon? How is his reticulo and vestibulospinal tracts firing at that point in time? In that first video, right? The rhombencephalon, the pons medulla and the cerebellum, what does that fuel? That fuels your vital centers in your brain, right? So if you have an underdeveloped rhombencephalon, you're going to have reduced tidal volume, right? In your lungs. So if you're not oxygenating your brain properly, is that going to allow for brain maturation and growth? No, right? So this is just, when I see that stuff, I don't just go, oh, his gait's messed up. Oh, his arm swing's messed up. It's like, no, his vital centers are compromised. His brain literally cannot metabolically grow. You see what I'm saying? Which, as a chiropractor, what is one of the afferent drives into the rhombencephalon? The upper 6 ribs. You see how important it can be, just a rib adjustment can be for some of these kids, right? Or something I have been doing with the Resimax, which I forgot about this, I should tell you, is I'll turn it up and I'll put the wings on the upper 6 ribs and I'll watch the pulse ox change because I'm driving the rhombencephalon with vibration with the Resimax. And so you can increase oxygenation and reduce the heart rate. Initially, it'll come up, the heart rate will come up because you're putting vibration on their chest and they're just kind of freaking out a little bit. And you leave it there and it starts to come down. It's really cool. And the oxygen goes up. Okay, now, so you saw the improvement in the gait after 1 day. Now here's what I did. I took the acoustic frequencies from the NeuroSage. This is immediately after. And I put those frequencies on this kiddo and look at how the gait changes now.
Oh, he got some arm swing.
Do it again. Hurry, Gunner, run. Go, hurry. Do it.
Good for you, girl.
The only thing that changed were the acoustic frequencies. When you start looking at how just music impacts the brain, it's huge. And then when you start understanding how these frequencies impact the brain, is even bigger. What is our brain built on? It's our ability to ambulate, our bipedalism, right? Are we changing the trajectory, the developmental trajectory of that kiddo's brain? Absolutely. Can you now substantiate how you're doing that just through a gait analysis? You see where I'm going? Isn't that cool? And now you understand it, right? And now when you have a PT or someone or a medical doctor, I'm going to have the head of pediatric brain injury is going to be observing me here in a few weeks. So now when that person's in there and I start showing them gait changes, I can actually tell them why that's important, and they've never heard that before. You see that? That's really cool.
So the frequencies you're using from NeuroSage?
It's just from the NeuroSage, yeah.
And what are those? Are those solfeggio frequencies? What are those?
A
No.
lot of stuff in there. But so this is what happens. So there's what we have is there's so much inside of it, but there's applications where you literally just turn it on and literally just have kids do core exercises of music. And so since Dr. Crawford and I work really close together, which we're going to keep talking about stuff, but we just, that's just something that we do with gait, walking with the frequencies too. So I think it's doing there.
Choose songs that are certain frequencies?
Yeah, so we have different.
Like
we're gonna
put-
teach module, we'll keep talking about that.
Yeah, like put the tunnel on, put the headphones on, and start doing stuff with them. Or use the tunnel. Okay, this one's cool. I want to show you real quick. So one way that I'll work with kids is I'll also play catch, right? Because it's fun, and it's fun for me, and it's fun for them, so we'll play catch. And so I was like, hey, Gunner, catch. And I threw the ball to him, and he was like, boom. It just hit him in the chest. I'm like, shit. So I'm like, all right, Gunner, catch. Boom, boom. Damn it. Okay, so I put him on the vibe plate. All right, Gunner, catch. He kind of tried. I put the headphones on, Gunner, catch. He caught it. But then he could not catch it on the left side. I thought, okay. So I started using the eye lights. But he's got a right brain deficiency, so I had the eye lights in the left hemifield, right? But he still couldn't catch it. And I was like, okay. So I went through and I did the cover-uncover test. And when I did the cover-uncover test, his right eye went whoosh. So I put the clear eye lights on the right eye, okay, just the right eye, as you'll see, and then watch how he catches the ball.
Good job. Good job. Nice.
That's pretty cool, right? So, looking at that kiddo, just based on what you've seen, where am I going to start to laser that kid first? Cerebellum, pons, medulla, right? Where can we laser all that stuff from? A magic spot there through the mouth? Yes, correct. How can we start to co-activate those systems? What are some ways? Perfect. What else? How can I co-activate the medulla? Throw a modality at me. How can I co-activate the medulla? A little bit. Yeah, that is one way. I can use, Okay, we could use the solitary nucleus for taste. We could use a carotid body reflex. We could gag the kid. If I don't like the kid, I'll gag him. Right? That kid that kicks me and punches me and spits on me, I'm like, yeah, I'm gagging this one. Sit down. Right? Pretty cool. And then you get into the pons. Acoustics are huge. Eye movements. Yeah, all those types of things in the pons, right? Vibration for cerebellum. You could do all sorts of things, right? So now we're building strategies, because what I want you to do is be able to think through this. I don't want you to just go, okay, where's my book and here's what I do. You need to be able to think through this and apply it however you need to apply it. Okay, this one was really cool because this guy was a war veteran, and he's been blown up like countless times. He's been in hundreds of firefights. He's showed me videos of him bunkered down with bullets whizzing over his head. He's got, I can't even tell you how many head injuries, okay? So here's the cool thing though, and this is why I wanted to put this one in there, because he presented with a left brain deficit. But he has a history of ADHD, has a history of developmental issues, right? So he's got a core right brain deficit, but he presented with a left brain deficit. So you're gonna see me working some left brain stuff, but ultimately I'm gonna flip eventually, like we are now, and now start working on the right brain. So, he's got the ATNR here, but again, this is just a different presentation that I want you to start to see. See how gentle I'm being with this guy? Because if I move him too fast, he's gonna punch me in the face.
That's fine. Okay, so I'm just gonna stroke down the back here. Okay, so that's pretty good. Okay. Now, tuck the chin for me. Good, and then look up at the ceiling, all the way up. Okay, let's go down, up the chin, and there's the S. And then up at the ceiling. Let's go down one more time.
So this is just one modality that obviously we did lots of primitive reflexes, we did lots of neurosage, we did lots of different types of things, but I wanted to see, so we're just doing some VOR. I'm using the laser, or my assistant's using the laser while he's doing this stuff. And then this was at the end of 2 weeks. Do you think he felt better? Yeah, he was a lot better. He was actually pissed that the military isn't using this stuff because, and I'm mad too, because these guys, they serve our country and they deserve better. They deserve better than just being thrown a bunch of prescriptions at them. It's sad. Okay, right brain deficit. This kid presented with severe chronic pain. Pain in both legs. No one can tell him why.
I think he was a little prematurely misjudged his age. It was a C-section, so the timing was chosen by us rather than by him. And so there may be consequences to that too.
Watch his lips.
I mean, is the other side moving, is that normal?
It's called a rooting reflex.
So, there's a leading, pain doctor at Stanford that tells me I'm wrong, or tells the parent that I'm wrong about this child, that there's no way that this is a central pain syndrome generated from a brain issue, right? And I'm like, my response to the parent, how can he substantiate that? Well, we need to do an MRI, and I'm like, look, he can't substantiate it. This kid's got primitive reflexes. His developmental issues, he was born, you heard he was born C-section. He had a torticollis. He actually had a torticollis 2 years prior to this, okay? Guess which way his head turned? His head went this way and tilted that way. That was his torticollis, right? Give me a break. 2 months prior to this, before he was in severe pain, he developed vestibular neuronitis. So he got an infection in his vestibular system, and it knocked him out. He was in a wheelchair. So he lost his afferent drive, okay? And that further caused an imbalance, and now he's in severe pain because of that, okay? So these are all different presentations of basically the same thing. You see what I'm saying? Now, is it the exact same thing? No, because there's different parts of that right hemisphere involved in each one. But you see what I'm trying to do here? You see that? Okay, cool. While this is the autism module, this is so applicable to anyone that walks into your office. And that's my message I want to get across here. Okay, so autism. So the size of the impact, guys, you affect that one patient, you don't just affect that one patient. You affect that family, you affect that community, you affect society, and that's how you affect the world, okay? You know this. This is huge. This is a letter. Now, before anyone raises their hands and says Snopes says that this wasn't written by Einstein, which, so I used to teach with Dr. John D'Onofrio. My absolute favorite quote by Dr. John D'Onofrio. Someone raised their hand during class and said, Google says you're wrong. He said, fuck Google, they're wrong. And he just kept going, right? Here's the thing. I don't care if Einstein wrote this letter or not. The words in it are applicable and are amazing, okay? So let's just go through this. This is Einstein, maybe, talking about love. And he says, when I proposed the theory of relativity, very few understood me. And what I will reveal now to transmit to mankind will also collide with the misunderstanding and prejudice in the world. There's an extremely powerful force. This universal force is love. Okay? What did I start talking about initially? These kids with autism, they lack the ability to love and they lack the ability to receive love. Right? So, when scientists looked for a unified theory of the universe, they forgot the most powerful unseen force. Love is light. Love is light. So, there's a couple of different things I can talk about here. In the beginning, God created the heavens and the earth. What's the next thing that came about? Light. Now, if you're not a believer, that's okay. So, you're saying there's a Big Bang, right? What was generated from that Big Bang? Light. So I don't care which perspective you take. Light was involved first, Light was involved first for a reason. Life cannot be sustained without light. I don't care who you are. I don't care what health profession you're in. Life cannot be sustained without light, and I will also tell you that life cannot be sustained without love. Do you understand that? What is the opposite of love? Fear. And everything else that follows is produced from fear. You see how that works? Hate comes from fear. Right? Most people usually say hate is the opposite of love. But hate is produced from fear. What holds you back in life? Fear. You're fearful that people are going to talk bad about you. You're fearful that you're going to fall on your face. Something that, Denzel Washington always says is fall forward, right? If you're going to fail, fail big. Forget falling back. Don't have anything to fall back on. Fall forward, right? So it goes on to say, love, okay? Love is light that enlightens those who give it and receive it. Love is gravity. Love is power. Love unfolds and reveals. Love is God, and God is love. Okay? Love is the one and only answer. It's pretty cool stuff, right? So, recently I've had a few people, jokingly comment, "Oh, your answer is always so Physio-me." Actually, it's not. But a lot of times when someone's asking me like a pretty complex question, or like it's a raging infection or autoimmunity or something like that, I do start with 528. Okay? Now, up to this point with you guys, I've been very objective with my protocols and with what I've been recommending. I've shown you the research. That's what I've done, and that's what I will continue to try and do. But at this point in time, I'm going to tell you this. There's a lot of research on 528, okay? But here's what I'm telling you. I get better results with 528. That's a clinical observation. Like you heard me talk last time about the Russian illumination protocols. They used 80 hertz. 80 hertz was what they found to be best. They didn't test 528. If you want to go with the research and use 80, that's fine. I'll get better results than you, and I'll use 528. Okay? So, okay. This is cool. This is a paper. They posed the question, is it time to consider photobiomodulation a drug? Okay? And I think the answer is this. Yes and no. Yes, because it is so powerful. Okay? It really is. Whenever you start using light in the right ways, with the right parameters, okay, with the right co-activation in the right manner, it is extremely powerful, guys. But here's why I say no. Its risk profile is so low, its safety profile is so high, I would not classify it as a drug, because drugs have side effects, right? And everyone knows that. And that's fine. For every effect there's a side effect or whatever, but the safety and efficacy of light is so different from that of a drug or a medication. But this is the kind of stuff that's starting to come out. Is it time to consider it a drug? It is that powerful, guys. Pretty cool. Now, we've been, Kyle just talked about a lot about acupuncture points. One point that I use a lot, and he didn't mention it because he knew I was going to talk a lot about it, is Heart 7. So in this study, again, they gave rats valproic acid. Okay, you heard Dr. Melillo talk about yesterday about how valproic acid induces autism. Okay, so they gave rats valproic acid, gave them autism, and then they started lasering acupuncture points. And they found that when they lasered Heart 7, the results showed that laser acupuncture at Heart 7 decreased oxidative stress, interleukin-6 expression, and GABA-T activity, but increased the expression of GAD65 together with the density of Purkinje cells in the cerebellum. Therefore, laser acupuncture at Heart 7 is a potential strategy to improve the cerebellar disorders and valproic acid rat model of autism. Now, here's the thing. Sham laser acupuncture failed to modify all parameters mentioned earlier. So that means whenever they took that laser and they used it either just to the side of heart 7 or somewhere else, they did not get the same results. That's pretty cool, right? Now, I've mentioned this study before. I wanted to throw it in because it's topical, right? So in this study, and this was done in the Cuba lab, which is a well-done study. It was good stuff. They lasered over 4 weeks. It was an 8-week-long study. They lasered. There were 8 treatments over a period of 4 weeks, and they just did a generalized approach. They did the back of the head and the sides of the head. Okay, that's what they did. And they took what they did is they used the aberrant behavior checklist and the global clinical impression scales. And here's what they saw. They saw a drastic reduction in these scales where the placebo stayed pretty constant, right? Now they stopped lasering here at week 4, but they continued to see results here at week 8, which is really cool. So not only are we getting effects, but those effects are lasting, which is really exciting. And then here again, you have the test group with the placebo group, okay? And here's something I like to throw in there. Very much improved, minimally improved, no change, worse, much worse. You don't see anyone here, right? That's cool. Again, high safety profile, okay? I can include it. You want me to? Okay.
And how often are they treated?
This one was a series of 8 treatments over 4 weeks. So it was just an even, yeah. Does that mean that that's the optimal dose and time frame? No, that's just what they picked. Correct. That's what they did. Is that the best choice based on the knowledge that we have? No, but this was a research study, okay? Now, we, Shedlight, we're going to do research, okay? And we're partnering with a group out of Brazil. And actually, one of the textbooks that I reference a whole lot, that was written by Dr. Hamblin and his team, that's the group that we're going to, hopefully be doing research with, and that's the goal. And that's where we're going to really start hammering a lot of the hemispheric-based protocols and whatnot. So it's going to be really exciting, really cool, okay? All right, microbiome. Let's talk about that for a second. So the study here was looking at infrared versus red light, okay? They did 14 days of treatment. And what they saw was that the diversity of bacteria was significantly different, okay? What they saw was there was a 400-fold higher in mice treated with multiple doses of infrared compared to untreated mice, okay? This observation confirmed for the first time that laser therapy can indeed influence the gut microbiome. And here's what else they found, is that the red light, because remember they were comparing red versus infrared, the red, okay, in our laser it's 637 nanometers, the red light did not change that microbiome. The infrared changed the microbiome. That's what they found, okay? So that's why I really like being able to go infrared versus red. But why would you use red over the gut? Why might we use red over the gut instead of infrared? Yeah, to affect the blood. Yeah, to affect the blood in the Russian protocol that we talked about. It also is really good at reducing inflammation. Okay, so the red light has more of a systemic global effect, and the infrared has more of a localized effect. Cool? Not directly, but there's indirect studies that show it can lower candida and yeast and fungal growths. Yeah, and so why does this work? Why did we change the microbiome? Because that laser didn't selectively kill some bacteria and selectively increase good bacteria. What did it do? It made that individual healthier. In the research, laser therapy is known as the great regulator, right? I always describe it as an adaptogenic herb. If you give someone an adaptogenic herb, it's going to raise or lower a system. It's going to regulate it, right? So when you do laser therapy on someone, you're improving their health, and because you're improving their health, their microbiome will change. Okay? Tissue regeneration. I'm going to briefly touch on this just because we've talked a lot about the primary effects that we talked about, in Module 1, how we affect cytochrome C oxidase, we begin to upregulate ATP, and we start to have all those types of changes. But there's also this type of activity going on where we start to affect transforming growth factor beta, which is really cool. And transforming growth factor beta does this. It triggers, protein triggers chemical signals that regulate various cell activities inside the cell, including the growth and division or proliferation of cells, the maturation of cells that carry out specific functions, cell movement, and controlled cell death. Okay? So the paper goes on to discuss cardiac, liver, neural, wound, burn, healing, all these things, but this is how we're able to regenerate tissue. Now, what are we doing with the methods that you're being taught this weekend? We're rebuilding a brain, right? That's the way I think about it. We're rebuilding the brain from the bottom up. We're going from the brainstem and we're ending in the cortex, right? This is something that's important to understand because if you think about it, we're kind of regenerating the brain, right? We're turning it on. We're causing nerve cells to reconnect. We're causing new proliferation and new growth of neurons. And that's why this modality is actually really important and very powerful with this work, right? Pretty cool. This one, so there's a lot of talk about toxic insults in autism, right? And I think Rob did a great job of discussing, how that's not necessarily the primary concern, but it is something to consider, right? So in this study, what they did is they injected a toxin into mice. They actually induced Parkinson's in this one, okay? But then what they did is they did remote photobiomodulation on the rats, where they lasered, I believe it was over the hindquarters or the gut. I forget where they lasered. And they actually saw that just by doing that, they caused neural protection and actually amelioration of symptoms that were induced by the toxin, okay? So by lasering a gut, by lasering someone like that, okay, you can actually start to evoke changes that could be toxic effects on someone. Okay, you can protect the brain even after a toxic exposure. Okay, or after springtime hits, and I've always been meaning to ask you this. During the spring, I always notice an upregulation in my tics and Tourette's patients. And I'm always curious. It could be from the allergies, or it could be from the the herbicides, or whatever. I don't know. I've just always seen that. You see that too?
Well, I mean, a lot of infectious diseases, have cyclic times, and sometimes it happens during spring or some more during winter. So, it's definitely an effect, whether it's a circadian rhythm effect, whether it has to do with, changes in day or light or temperature or changes of gravitational pull. It's hard to say exactly what, but
right. Yeah. Well, I'm in Austin, and so there's so many different things that people are allergic to there. It's crazy. Okay, so let's apply this stuff. So here's what we're going to do. We're going to use, remember the acupuncture meridian revitalization, okay? So we're going to take the laser, we're going to put it on 528 hertz, and we're going to perform those beginning and ending points. Now, what Dr. Daigle talked about, I should have put that in here. You're going to go to Daigle all, right? So in that file, you're going to go to his file, Dr. Daigle, go to all, so it cycles through them all, put them on the umbilicus, and then run through your beginning and ending points, okay? That's a great way to, that's...
A minute?
Per point, to stimulate the point?
No, on the Daigle all.
So you're going to put it on the umbilicus and leave it there while you're doing the other points. Yeah, totally. Okay, we're going to add in stomach 36, spleen 6 like Kyle talked about, and then I'm going to add in heart 7 here. We're going to laser over each ear because you can access every acupuncture meridian in the body from the ear for about 30 seconds each. If you can identify a specific meridian that needs attention, remember we talked about that last time, okay, based on the horary clock, based on symptomatology, okay, then we can run the laser along the entirety of the acupuncture meridian, starting from the beginning point, ending on the ending point. Do this for about 1 minute over each meridian 3 times. So first thing we're going to do, we're going to clear the meridians, right? Next. Oh, I skipped one. Next, we're going to go through our Russian blood illumination technique, okay? This was in module 3 where we hit it hard, okay? That's where I introed it. We're going to go again to 528. We're going to do at least 5 minutes per location. That's the umbilicus and the carotids is where I'm primarily going to laser for the Russian protocols, right? So we're going to do that. Again, that's great for reducing inflammation, regulating autoimmunity, stimulating stem cell proliferation, that kind of stuff, right? So this is actually, I mean, I literally, like, if you come into my practice, I start every patient like this. This is literally what I do. Then we're going to switch to the gut protocol. We're going to use over the abdomen. I'm going to talk about co-activation here in a second. We're going to use the Shed Light Neuro, the gut setting, okay? We're going to use it on infrared, right? Because remember, I just told you, infrared changed the microbiome where red did not, okay? So we're going to use the gut setting on infrared. We're going to do it at least 5 minutes over the abdomen. Then we're going to ID the lowest level brain integration per the methods that you're learning, okay? And we're going to begin to laser accordingly. Brainstem, cerebellum, okay? We're going to use the CBM imbalance on the medulla pons cerebellum vestibular system, red and or infrared, okay? You're going to use 2 minutes, then retest. On the midbrain, we're going to use the midbrain setting, okay? Same thing, 2 minutes, then retest, okay? We good with that? These are all things that we've already learned. We're just putting it all together now, okay? Then we're going to move into the cortex. While co-activating, right, you'll want to use the brain cortex frequencies. I designed that setting to bind sensory motor activity. That's what the brain cortex setting is for. So this is designed for co-activation of the cortex, okay? So when we're co-activating, we're going to use the brain cortex. We're going to use it on red, and we're going to do the right PTO, the parietal temporal occipital association cortex. We're going to then move to the motor strip and then end at the prefrontal. Now, we're going to be monitoring the patient while we do this, right? So what if everything's going good, you laser the brainstem, you move to the cerebellum, you're getting up into the cortex, and your pulse ox starts to fail? Stop. Absolutely. Stop. Don't go, oh, they'll be okay. Keep going. No. That's that you reached a fatigue point. Stop. Okay? Okay. All right. Now, co-activating the gut. Ways that we can co-activate. Are these the only ways? No. Right? You can do this lots of different ways. I love the Resimax. Again, he talked about it yesterday. You can put it in the mouth. You can put it over the vocal cords. You can use it over the abdomen. All this kind of stuff. Remember, when you're vibrating in the mouth, okay, that's activating the trigeminal nuclei. Trigeminal nuclei is the largest group of nuclei running through the brainstem. You're bringing a lot of blood flow into the brainstem at that point in time. That's really cool. So you can vibrate there, and then you can start to activate the specific vagal nuclei, right, to get even better targeting. You can do some gut vibration. You can use some, I like to use pulsed radio frequency on the auricular branch of the vagus. Okay? You can do some horizontal eye movements to activate the pons. Right? You follow? Now, some other things. Humming, deep breathing, smell. Okay? Smelling something good, like salty, to get those digestive juices flowing, and then lasering over the gut. Eat just before lasering, because why? If you're eating, what are you activating? Yeah, you're activating your digestive system, your vagal system, right? Are you activating parasympathetic or sympathetic? Parasympathetic. So, tell them to eat something, or have, I've got snacks in my office because I'm eating all the time. I'm either eating a lot or I'm fasting. It's funny. Give them something to eat, okay? They can take a small amount of a digestive enzyme, okay, about 20 minutes before lasering. Small amount. You don't want to burn their gut up. But if you really have someone comes in and they have gastroparesis, Okay, they have gastroparesis where their gut's just not functioning, it's not moving at all. Give them a little bit of a digestive enzyme, small amount, or maybe some digestive bitters, and then start lasering the gut. Okay? All right. Cool stuff. Here, this is actually a girl with Down syndrome. Again, I brought the headphones out to this girl when we were doing the Russian protocol on her, and the mom goes, there's no way she's going to wear those. Not going to happen. So I turned it up real loud, and she was like, what is that? And I put them on there, and she just melted. Okay, that's the power of these things. So what I'm doing, I'm using the Resimax on the gut. I'm doing pulsed radio frequency on the auricular branch of the vagus. I'm going to bring that next time and show it to you guys. Okay. You hear the tunnel in the background? Okay. Now, should I laser before, after, or during this exercise? I have a during. There's two right answers. During and after. During and after, right? Because you're going to activate neuronal pools, and then it's not like when you stop, they turn off, right? So you're going to activate neuronal pools, and they're going to stay active after. So if it's difficult, right? So my hands are full, so I'm going to activate those neuronal pools, and then I'm going to come in and start doing the laser therapy, right? Make sense? Okay. And there's a Resimax, and you know about that. Any questions? Are we good?
I have one question.
Yes.
So that very first case with that boy with the stomach ache,
Yes.
did he just out of the blue start having a stomach ache?
No, it was a slow, gradual thing, right? It started as a stomach pain, and then it led to a worse stomach pain, and then it led to vomiting, and then it led to unrelenting gut pain that he could not live with. He had to drop out of school, ruined his life for like years, which in your case history, you can rule out things like, right? This was a gradual, insidious onset. We should be able to think through these things, right? Yeah, cool.
Okay. Now, I haven't told Brandon this, but there's going to be another reason why you're going to want to promote my book, is because in the Einstein's Desk book, one of the premises we do is that the basis of, like, one of the most core basis things in the universe is the photon, and that it's light, and that's ultimately that information is what we use for time travel. So it's pretty cool. I have to say, I enjoy so much just listening to these guys, but this week especially, I mean, Peter killed it yesterday. He gave you such unbelievable information that comes from a wealth of clinical knowledge, right? And Brandon and Kyle, I've had the opportunity to see them lecture a lot lately. They were just with me in Amsterdam. They've been with me in Barcelona. They've been here. And I've seen the progression of their lecturing, and today was just outstanding for both of them, right? I mean, really, just the confidence, the fluidity, the practicality of the content, as you've seen, has gotten just better and better and better. And I've been emphasizing it with them, clinical, give them the jewel. But, there's one thing, because you can get someone up who can lecture. People can regurgitate my knowledge, but I can't give them clinical expertise. I can't give them these pearls that they've discovered on their own by experience and trial and error. Nobody can give that to them. So you can go to courses where people lecture and they regurgitate something they heard from somebody else with no clinical experience, and there's a big difference, right? This is their clinical experience. And again, for me, it's just a pleasure because I learned from it, because nobody knows everything, right? Nobody's going to stand up and be that they are the only person and that they had knowledge that came to them when they were born. They knew all about the nervous system, and they never made any mistakes, and they've always done things this way. And anybody that says that, it's just full of shit, and they're lying to you. Anybody that acts like they know everything, and there's this one person that's going to give you all their knowledge. No, I mean, for me, it's always been about a team. It's always been about a collaborative effort. It's always been about sharing, that together. Because we're all teaching not from a place of ego. We're teaching because we're all here because we really want to teach. We want to, and it's a journey that gets us better. Every time we teach, we learn something. So anyway, I thank you, but really great job, really so appreciative. And even just being able to bring people like Tarek here where, to actually bring Peter Gillet here so you can hear from someone who made the highlights, someone who made the Resimax. That's a rare opportunity. And it's one thing to talk about a tool, it's another thing about hearing from the guy or the gal or the person that actually developed it, right? So you're getting a tremendous amount of information here. All right, we got, say, 12:40. We're gonna keep it short to an hour, okay? Legitimately, if we can, for lunch, if that's possible. I'm gonna start up at 1:40. Before we leave, we're gonna get a picture so that everybody can post that on social media. Please turn on the light over there, Peter.